we turn it over to my colleague, Dr. Neil Gupta. In particular, well, all of the presenters and panelists have raised different issues regarding screening, linkage to treatment, adherence to care and treatment, monitoring outcomes, raising, informing national policy development, and wanted to have Neil touch on some of those gaps and how research can address them. Neil?
Great, thanks, John. And it's a pleasure to be with colleagues today. Very interesting presentations and discussions so far. Next slide, please. As John mentioned, at the Coalition, we've been very interested in learning from these guidelines and really acknowledging the additional pressures that these expanded guidelines, as described by so many of our speakers, will place on already overstretched health systems. I think we've all been following the news recently and realizing that health systems are only going to be further challenged to address infectious diseases, not only Hep B, but HIV, TB, malaria, and others that have been externally funded for so many years. These expanded guidelines will put pressure on low and middle income countries to respond to additional diagnoses and treatment eligibility. Next slide, please. So in that light, next slide again. In that light, I think the WHO guidelines, and as you flip through, you can see that through each chapter of the WHO guidelines, they've offered a research agenda, and many of the guideline leadership here well knows that there are over 54 bullet points on research questions that can be explored or that are recommended to be explored in the upcoming years, but not necessarily a prioritized look at which questions would be most critical to expand service delivery. Next slide. So at the Coalition, we were quite interested in this question, and I think Dr. Ajit brought this up in terms of operationalization and simplification of health system delivery for expanded treatment guidelines. And we assembled a group of researchers, hepatitis B experts and researchers from LMICs throughout 2023 and 2024, brought them together to really think about how we could identify operational research priority areas, key questions for research, how we could describe high priority research studies and start to detail those out, how we can assess existing and needed research capacities in LMICs, and also how we could best engage national policymakers. When this group came together, they identified several key themes. The first is that strong evidence-based models of care delivery are needed for hepatitis B, based on lessons already learned from hepatitis C and HIV care delivery, and that operational research should really take a core philosophy of learning while doing. So not necessarily waiting years and years for research results to inform care delivery, but rather to roll programs out, but to do that in a way where we're actually measuring the impact of new operational methods. Next slide, please. We kicked this group off by conducting a scoping review on evidence gaps for operational research in LMICs for hepatitis B care delivery. And we found only 56 studies that implemented and measured the effect of an intervention. There were major evidence gaps, which I think doesn't surprise anyone here, in terms of screening, assessment, linkage to care, treatment, monitoring, and also cross-cutting issues around healthcare worker training and education, community awareness, and engagement. These evidence gaps linked well and coincided with qualitative information from each of these researchers as well as to what they saw as operational research needs in their own countries. Next slide, please. This also complemented a commission study that was done for the Guidelines Committee, looking at care cascade outcomes and doing a systematic literature review on care cascade outcomes globally. You can see here just the size of the circles indicate the number of individuals included in care cascade models. And you can see that in the highest burden areas of sub-Saharan Africa and Asia Pacific region, South Asia, less studies having been done and smaller cohorts having been generated. Next slide, please. So with the group invited by the coalition to join a workshop, as well as the scoping reviews and qualitative interviews, we were able to produce a set of priority areas for operational research in hepatitis B to simplify care delivery in LMICs. And we really came down on 4 priority areas. The first was to simplify delivery models to assure decentralized and equitable access to hepatitis B testing and treatment. The second is really around PMTCT. Third was developing and operationalizing technologies, particularly around Hep B diagnosis, treatment and monitoring. And then fourth, thinking about back to the question of who to treat, understanding which persons are at highest risk with a Hep B infection to progress to fibrosis or hepatocellular carcinoma. So a bit of a different lens on research priorities than the WHO guidelines, which were much more comprehensive and systematic in nature. Here, we went through each one of these priority areas in a workshops format. If you can go to the next slide, please. Encourage you all to download our operational research roadmap. But here's just an example of, for example, in priority 1, some key questions that could be answered via operational research to inform decentralized service delivery models. Next slide, please. For example, the first question here, how can hepatitis B testing and treatment be effectively provided by non-specialists at different levels of the healthcare system, particularly thinking about rural facilities manned by non-specialist healthcare workers in rural parts of sub-Saharan Africa being a first priority. Next slide, please. So just illustratively to show you that we do have tables in this roadmap around the design options, study examples, and outcomes of interest to be measured in a standardized and systematic fashion by research studies outlined in the roadmap. Next slide. So you can just advance through these. Again, this is priority research area number 3 and area number 4. And if we look at these, if we go to the next slide, just in the interest of time, you can advance through this just to show how some of these research priorities map to the WHO guideline research priority areas. So in looking at our research priority priority area number 1 around decentralized simplified care models, really mapping to some of the simplified service delivery aspects on the left side of this comprehensive research agenda. Our priority area number 2 in the roadmap around PMTCT obviously speaks to the bottom right corner of treatment in adolescents and children, as well as the use of prophylaxis during pregnancy. Our priority area number 3 around the development of innovative testing technologies really speaks to the use of non-invasive tests, point of care Hep B DNA testing, and reflex DNA testing. And then priority area number 4 around monitoring and surveillance for long-term outcomes and determining who to treat. So we found a real nice concordance between the operational research prioritization exercise that we went through for the roadmap with the comprehensive research agenda outlined by the WHO for hepatitis B. And we hope that the roadmap gives some very practical and actionable tools to guide LMIC researchers, and also can serve as a advocacy and fundraising tool to bring in new and additional funders into the hepatitis B funding ecosystem, which we've already kicked off here as part of the roadmap. This initial work was funded by a philanthropic group called Open Philanthropy here in the US, and has already committed to the phase 1 of operationalizing this research roadmap. So at the UN General Assembly last year, at the Group of Friends for Hepatitis convened by the UN, we announced the launch of Core Hep B, or the coordinating center for operational research for hepatitis B and LMICs that will be housed at the Coalition for Global Hepatitis Elimination at the Task Force for Global Health. This is a roadmap that describes some of the activities that Core Hep B will be taking on. So not only assembling a portfolio of operational research with investigators from LMICs, but also engaging policymakers early on in respective countries where research is being conducted so that there can be seamless translation to programs and policy from research outputs. As well as long-term goals of capacity building for research institutions. So welcome you all to visit our operational research roadmap, and we'll be following up with more details about Core Hep B, which will be discussed in greater detail at the upcoming Global Hepatitis Summit in Los Angeles in March of this year. So thank you very much, and with that, I'll pass back over to John.
Thank you very much, Neil.